Medical Students 2023. Today marks another chapter to live, another story to tell, and another moment to treasure. For today, we will witness the induction of newly joined first-year postgraduate medical students. I extend my warmest congratulations to our new postgraduates on their achievement. Wishing you more success in future. Now it's time to invite our honorable dignitaries. I consider it a great honor to welcome Dr. J. Bennett Abraham, Sir, Director, Dr. Somerville Memorial CSI Medical College. Next, we have our Principal, Dr. Anisha J. Madam, Anisha Merlin Madam, and I also invite Reverend Father Sushil, Head of Chaplaincy Department. And finally, I invite our PG Coordinator, Dr. Pradeep Hester. Prayer works wonders. Now let us begin today's program with praise of the most merciful and the most benevolent. I would like to call upon Reverend Father Sushil, Head of Chaplaincy Department, to pray for us and bless the occasion.
Mighty Lord of wisdom and knowledge, thank you very much for all your blessings. As we begin our new class, be with us and help us to complete the course for the blessing of us and for many others. Lord Jesus, who sacrificed your life for our salvation, growth, healing and liberation, help us to work and be a witness in the world around us. We pray for our parents, teachers and all others who help us to take challenges in studies and life ahead. Thank you for selecting us, for participating in the healing ministry. Lord, we need your strength and courage to be optimistic in the struggles and obstacles of life. Give us your compassionate heart and help us to understand the pain and struggle of others. We ask everything in the name of our wounded healer, Jesus Christ. Amen.
Good morning. First of all, I thank God for making me and my department to be able to organize and conduct the program. We are extremely happy this year due to two things. First of all, the PD coordinator regarding the PD status of this institution. Two of our departments, general medicine and dermatology, got PD seats allowed from this time. Moreover, there was increase in seat in orthopedics and radiodiagnosis. My job is to welcome the dignitaries at the dais. Bennett sir needs no introduction. He is an excellent administrator as well as heart, brain and soul of this institution. He is instrumental in transforming a small building, hospital building into the Taragon CSA Medical College stature. His vision and guidance and help it to get increased UD seats, PD seats and increase the strength of faculty. Moreover, he knows introduction or welcome, everyone knows him. In spite of that, I take this occasion to invite Bennett sir for this function. Principal Madam, we had a class, physiology class. After that class, he has come in spite of her busy schedule. He is always cooperative, cheerful, friendly, and approachable. And we find it a happy experience meeting her, discussing the academic and administrative activities in office. In spite of her busy schedule, he has taken after class to come here and welcome us. So I welcome Madam. Father Sushil, Reverend Father Sushil, Head of the Chaplaincy Department, gladly accepted the invitation in spite of his busy routine. I also welcome Father for this function. Before winding up, I pray God to help all of us, bless us in our personal life and professional career. Thank you.
Thank you, sir, for your earnest welcome words. We all agree that our director, Dr. J. Bennett Abraham, sir, is indeed one of the best leaders we all know. We would like to make sure that our institution and its students shine the brightest. It's my pleasure to invite Dr. J. Bennett Abraham, sir, to deliver the inaugural address.
Robert Hudson, Principal, PG Coordinator, and my dear students. Out of the 28, come. Out of the 28 of you who joined, now I'm sure we were counting and 2 more are to come, no? All the others are here. I think 2 of them are from Karakoram itself who did their undergraduation, Sandra and Chris. Yesterday, the health minister inaugurated the state residency program for the 2021 batch. And you all are 2022 batch. So in that meeting, the Director of Health Services, Director of Medical Education, principals of various colleges were all participating. A point which the Health Minister and the principals of colleges and the DME mentioned was, the 2021 batch is probably a privileged batch to take up the challenge of moving out from the tertiary care center to the secondary care centers or to the primary care centers. What you learn in books for your MBBS and for your post-graduation is definitely different from what you go and see what you go and practice in the community. In fact, yesterday when we were deliberating on these things, a conclusion which came up was like this. We send our students to learn swimming. They jump into the pool, they beat around in the water and then learn swimming. But now technology has developed so much that it is all available in the YouTube and in the net. But you can never learn swimming just by reading what you see in the net or in the YouTube. We definitely have to practice it. Same way, postgraduate studies is not like undergraduate studies. Postgraduate studies, the more time you spend with the patients, with the clinical materials, with the specimens, whether it be pathology, and when it comes to community medicine, the time you spend in the community matters quite a lot. Hands-on exposure, hands-on experiences are definitely necessary. There is no way out. Just by learning theory is not enough to practice an expertized practice when you come out after your PhD. Just by sitting and reading how to conduct a delivery, you will never be able to conduct a delivery until and unless you be assisting, you be involved in conducting the delivery. In the same way, when it comes to anesthesia or when it comes to any discipline of clinical medicine, there is no doubt. The more time you spend with the patients, the more time you spend in the wards and in the operation theatre is what will make you an excellent doctor tomorrow. So when the when the postgraduate Residents Association president was talking, he was saying, we land up doing duties for 36 hours at a stretch, and sometimes even much more. Unfortunately, this has been the dictum for many decades. By introducing the district residency program, he was saying it will probably give us a little time to relax, at the same time to learn the national health programs and to face the realities of the common people. I was going through the program which Dr. Pradeep had coined for you all to undergo for the next 3 days. Excellent topics have been chosen. How to handle medical legal situations, palliative care, your role as a trainer and as a trainee, the importance of documentation, patient and the doctor relationship, communications. The director of RCC mentioned yesterday, going an extra minute by explaining to the patient, telling them the truth, explaining to them and developing a confidence in them, prevents the doctor-patient conflict and destroying hospitals. No doubts about it, it's very true. Now my request to you all would be, spend more time in the ward, in the theatres, wherever you are able to learn practical medicine or surgery or whichever specialty you have taken up. Please do have a compassionate heart towards the patients who are coming to you in pain. You are the residents, just like the nurses being available with the patient always. You are the people who would be with the patient to find out what exactly is happening, how, where each thing is going. I was admitted maybe 3 months back, I think just by the time you all joined, I was admitted here with a muscle tear. I remember the ortho PG coming promptly, at least 4 times a day, just to ask me how you are and finding out whether there is more pain. See, the more time you are able to give to your patient makes them happy, and no doubts will make you a better doctor. Have a human heart, a compassionate towards these patients and to their relatives as far as possible. Discuss with your head of the departments or with your consultant. Interact with the patients. Sometimes it may be a bad news which you may have to break, but take your time. Think over it instead of making it just abrupt. Educate them in such a way to face the situation. And I tell you, you will be able to make a gross change, not just in the lives of the patients and their relatives, even for your institution, where you are going to be doing your PhD, where you are doing your post-graduation. And this will definitely make you happy. Yesterday, at that program, many of our alumni, old students were there from Trivandrum Medical College and from other institutions doing their post-graduation. Some of them came and told me later, their stay here, how they enjoyed it, and how we had trained them up during their house surgency period. They are finding it easy to cope up with the pressure or work pressure for their post-graduation. I wish each one of you all the very best. Do your best and let your postgraduate studies be a memorable one, which will be of greater use for your future. Thank you.
Thank you, sir, for your enlightening words. Our principal, Dr. Anisha J. Merlin Madam, merely require any introduction. We are all proud of you and your distinguished hard work. May I please request Dr. Anisha Madam to present the presentation speech.
PG Coordinator Dr. Pradeep sir, faculty, members who are here, and my dear postgraduates. Very warm good morning to one and all. So this batch of postgraduates is very special to us because we are having the first batch of medicine as well as dermatology postgraduates here. And from 21 postgraduates, we are very happy to have 28 postgraduates. And I'm very happy and proud of each one of you. Very happy to have selected our institution to be your alma mater, apart from 2 of our own students here. Postgraduate education, as Sir said, is quite taking a new journey here. God bless you. Thank you.
Thank you, madam. Now I request Dr. Vijaya Rani, Assistant Professor, Pharmacology, propose the vote of thanks.
A very good morning to one and all. It's an immense pleasure to propose the vote of thanks. First of all, let me thank Almighty for showering His blessings upon us. Lord, your grace is sufficient for us. Thank you, Lord. It's our honor to thank the director of our institution, Dr. Abraham sir. Thank you, sir, for your honorable presence and for the blessings in spite of your busy schedule. Ever since the beginning of this institution, sir has been tirelessly working for the upliftment of this institution. And sir will always inspire us and motivate us to learn and try out new ways to do things better. Thank you, sir, for your inspiring words. Also, sir has mentioned something about the PG curriculum and the district residency program. Thank you, sir. We also take this opportunity to express sincere gratitude to our principal, Dr. Ansha and madam. Thank you, madam, for your gracious presence and for the blessings. Madam was always a great support for conducting and organizing this program. Madam has granted us permission to use this gallery hall as the venue, and madam has also been a great support and guidance to us. Thank you, madam, for sharing, elaborating the PG curriculum again. Now I express sincere thanks to Reverend Father Sushil, head of the chaplaincy department. Thank you for the good blessings. Now I extend our hearty welcome, hearty thanks to our PG coordinator, Dr. Pradipus, HOD Pharmacology. Without sir, this program would not be a success. Actually, sir has started the preparation for this program a few weeks back, and sir was always interacting with the postgraduate students, the audiovisual technicians, and the general superintendent and all the cleaning staffs to make necessary arrangements. Thank you, sir. And we sincerely thank the general superintendent, Mr. Shaji, the audiovisual technician, Mr. Binford, IT department, Mr. Dinesh, cleaning staffs, housekeeping staffs for all making the necessary arrangements. I thank my colleagues, Dr. Prasanna sir is busy with the paper graduation, and Dr. Shadi sir and Dr. Brahmana, the angel who has supported us. And now I thank all the PG students who will be with us. I am sure that these 2 days program will be definitely informative one for you. Thank you all.